CENTER Maine is partnering with the-maine-monitor to bring you some of the reporting done by journalists with the nonprofit independent publication. So we'll be featuring one of their stories each Monday. Today, we're talking about birthing centers and how so many are closing around the state. That includes Belfast, Waterville, Fort Kent, and York, just to name a few. And over the weekend, the Maine-Monitor published the first in a series of stories that will explore these closures and potential solutions to the problem. Kate Koff is the editor of the Maine-Monitor. She co-reported this series with Emily Hedegaard. Kate, thank you for joining us.
Oh, thank you so much for having me.
So let's start with this. It seems like we keep hearing about the closure of birthing centers, sort of one after the other. Can you give us a sense of the scope of what's happening?
I'm sure your viewers have heard quite a bit about this, but we have seen 9 closures or announcements of closures in just the past decade in Maine. Last year, we saw hospitals in Belfast and Waterville announce that they would stop delivering babies this coming spring. The year before that, in 2023, we saw hospitals in York, Rumford, and Fort Kent announce that they would close their labor and delivery units. So really, no area of the state has been spared in this, but I would say that these closures have hit rural communities particularly hard. And all of this means that as of April 1st, we will now have about half of Maine's 36 hospitals that will no longer have dedicated labor and delivery units. Most of our 16 counties will have just one birthing unit remaining as of April 1st. And Waldo will become the first county to have no dedicated labor and delivery unit. And as of 2022, we had more than half of all rural hospitals nationwide that did not offer labor and delivery services. So it really is not unique to Maine. This is something we're seeing everywhere.
That said, what are some of the reasons we're seeing for these closures?
Town after town, we've heard the same 3 things. The primary one is that there's just a real difficulty hiring, particularly post-pandemic. These hospitals are having a lot of trouble recruiting providers to rural areas. So that, I would say, is the primary thing that we've heard. We've also seen, a declining number of births in Maine. We are one of the most rural states in the nation, and we have a fairly low birth rate. And we also see, reimbursement rates from both MaineCare, the state's version of Medicaid, and from private insurers that just don't approach the cost of, what it is to provide this service in Maine. As anyone who has been pregnant or knows someone who's been pregnant is aware of, even in a very healthy pregnancy, things can go sideways quickly. And so you have to have these highly specialized folks on staff or on call at all times, which makes it really expensive to keep these units open.
And certainly scary for people living in some of those more rural areas. In your digging, have you come across any solutions to these problems?
The first story will focus primarily on outlining the problem, but we will have a piece that focuses just on solutions and some of the interesting things we've heard. And I would say there are some creative things that are being floated, creative ideas. We have written in the past, the Monitor has written in the past about a hospital in Machias, Down East Community Hospital, which is the last remaining labor and delivery unit in Washington County. It's really a center of care for pregnant people throughout the county. And a few years ago, they were at risk of losing their labor and delivery because of the high costs. And so they decided to train nursing staff from other areas of the hospital to flex between the medical surgical department and obstetrics. That has allowed them to continue providing obstetric care. So training, staff who may not be specialized in obstetric care has been one option that has been floated. I think one of the biggest things that we heard that could make a difference was changing reimbursement rates. As I mentioned, for MaineCare, there have been some proposals floated around that. MaineCare coverage was extended to 12 months postpartum a couple of years ago. So that has been something that experts around the state are pushing for. We also heard of, one of the big sort of bottlenecks in all of this is that there are nationwide more graduating medical students who want to become obstetricians than there are residency spots. So one of the interesting things that we heard was, if there were a way to establish residency programs in rural areas, that could go a long way toward keeping physicians in those rural areas after they complete their residency. Research has shown that where you do your residency has a big impact on where you continue practicing. And right now, most residency programs are concentrated in large cities. So if there could be a way to train physicians in rural areas, that could keep them close to those places after they graduate.
Certainly an interesting series. I look forward to reading more. Kate Koff, thank you for being with us.
Yeah, thank you so much for having me.
And you can read much more at the-maine-monitor.org.